Hope everybody's enjoyed their lunch. Aki and I have decided that this is going to be our MO for the remainder of the conference, especially as we jump into the roundtables where we're excited to stimulate important dialogue amongst patients and researchers. And you're going to see the power of project impact in play because there's going to be some really cool deliverables from this project that you're going to see today. And I can't share any more without overstepping my boundaries. But with that, Jim told me to get started. Who should I pass the mic to get started?
Got one.
All right. Well, Melissa, please take it away.
Thanks, Emily. Hello, everyone. I'm really excited to be up here. I hope this is not too loud. Really excited to be up here to introduce our day one roundtable. This roundtable is going to be focused on PFIC Network's research program Project Impact. Joining me today for this roundtable is our Impact Project team, and that includes Jim Squires from UPMC Children's Hospital of Pittsburgh, Gita Lubke, who is our science advisor at PFIC Network, Alex Perez, who is our community council chair, as well as Paulo, who is our web developer for the project. And of course, I forgot to introduce myself. I'm Melissa. I help run the advocacy and research engagement programs at PFIC Network. All right, so during the next 2-hour session, it's a little bit of a time we'll have together. We're going to be sharing a crash course on all things Impact Project. So we're going to give a little more background on what we're doing, and also some education on what patient-centered outcomes research is, which undergirds the foundation for our project, and as well as progress updates of things we've accomplished in the past several months since we started. One of the major deliverables is the Impact web app, which we are officially launching the beta version today, and Paulo and Gita will be sharing more about that. And then we will spend the remainder of our time together doing a roundtable discussion about how patient-centered outcomes research could support treatment decision-making for PFIC. All right, so I'm going to share a little bit more about the project. So PFIC Network received an award from PCORI, or the Patient-Centered Outcomes Research Institute, last July. PCORI is a U.S. government-sponsored nonprofit that was started through the Affordable Care Act in 2010. Their primary function is to fund patient-centered outcomes research studies and related projects. This is a unique type of research that focuses on comparing existing treatments, but from specifically the patient-perceived outcomes that are most important. Another integral element of patient-centered outcomes research is that patients are involved throughout the research process, from writing grants to study design, and also how to disseminate the results to the patient and researcher community. The specific award that we received from PCORI is the Eugene Washington Engagement Award. This is an award for 2-year capacity building projects, and so we're setting out to prepare the PFIC community to engage in patient-centered outcomes research studies. And our project we titled Impact, which is a fancy acronym that stands for Identifying Research Targets by Merging Patient and Clinician Treatment Information. And we're going to learn more in the coming moments about why we named the project that. So we were inspired to pursue this PCORI Award and this project from discussions at our conference back in Pittsburgh in 2022. We heard from patients and parents that they felt uninformed in their treatment decisions. We've heard echoed from clinicians in the room that there aren't any quote-unquote standards of care, clinical care guidelines for PFIC, and it's also unclear how patient preferences are systematically incorporated into care decisions. And so patient-centered outcomes research is one avenue that we can start to address these challenges in treatment decision-making, and the study results can generate more knowledge for better, more informed healthcare decision-making. And so to start working in that direction with our community, we set out with our project goal of preparing the patients and researchers to participate as equal partners in research studies. And we aim to do this through empowering and educating patients and parents to be partners in the entire research process, also identifying outcomes that matter most to PFIC families, and also establishing a roadmap together for how we can conduct PFIC research as partners in a way that respects the interests and needs and the barriers facing our unique community. So we are accomplishing these aims through activities that began last July and are ongoing. So we have online learning modules that include accompanying feedback surveys, as well as focus groups, which we run every other month. And patients and clinicians and researchers are invited to participate in all of these activities together. We also have the Impact web app, which we'll learn more about today, and that was actually designed through these focus groups collaboratively between patients and researchers and clinicians attending. And all of these activities that we're conducting through this 2-year project will culminate in a research roadmap, which is a resource we hope to produce that will help guide the PFIC network in future endeavors with patient-centered outcomes research, and also provide helpful guidelines for how to conduct research in general that is more patient-centric. All right, I'm going to now pass the mic to Jim to share a little more about patient-centered outcomes research.
So this is going to be quick, because we really want to get to the meat of what we want to discuss today, which is impact and the kind of progress we've made. But we figured before we went there, we would at least kind of go back a little bit and talk about patient-centered outcomes research, give a primer on what it is and kind of why we do it. And so, patient-centered outcomes research, as Melissa talked about, is primarily funded through the PCORI Institute. And to do this research well, it really works to identify measures and outcomes that are noticeable and meaningful and impactful to patients. And it does this by answering these types of questions. And this is really just kind of a screenshot from the PCORI website. But again, the focus is on kind of outcomes that are going to be important and impactful to patients. And so when you're talking about these outcomes, traditional outcomes in research are like, is the patient alive? Is the liver in them? What is the GGT and the bile acids? These are kind of the things that traditionally we have looked at in research, from a clinical standpoint. But these are really outcomes that, of course, they're important to patients, right? But they may not be all of the important outcomes that are important to patients. Because maybe patients are more interested in quality of life, or spending time with their families, or returning to work or school, or kind of living healthy, productive lives. And so I think there are outcomes outside of those traditional research outcomes that we really want to learn to focus on. And so it's clear that to better understand these kinds of issues, we need to consult with patients. We need to understand their disease processes and what those outcomes are going to be. And to do this really involves patients as partners in the research, right? Because this ensures a dedicated focus, kind of on the outcomes that are important to patients. It provides insights, right? Important insight into their actual experiences and their their lived day-to-day lives with this disease. It inserts, the perspective of these patients and how they are living with the diseases that they have. And it also kind of sometimes can uncover important kind of cultural and language issues that maybe we would overlook in traditional research. And so, what's the process? How do we do that? There are standards that have been published that are associated with patient-centered outcomes research, but at a very high level, and without kind of boring everybody with all the details, it really comes down to engaging stakeholders and how we do that, identifying those meaningful outcomes that we kind of talked about, and then dissemination, right? How do we then get that back out to the community? And so, when we talk about engaging stakeholders, it's important to note that there are really different levels that you can kind of engage patients. And so again, patients can just be informative. They can be there to answer questions that we ask. They can participate in the research, and many of the patients in this room have done that. But you can kind of go beyond that, right? They can be consultants and actually provide feedback and advice on specific research activities. They can be directly involved, right, with the research, either through focus groups or other metrics. They can actually be collaborators where they're kind of seen as equal partners in the whole process. And ultimately, they can actually lead the research, right? I think that's another opportunity. And so there are various ways to kind of engage them in this. And at the end of the day, no matter how you want to engage, it's important when you're doing these projects to outline early on which level of engagement you're going to do, right? You have to identify that, and you have to write it down, and you have to make sure that that's been something that's been specified. And then you have to identify those meaningful outcomes, right? So again, this often involves patient-reported outcomes, which is that promise metric that Geeta talked about in the registry, as well as others. And when you're thinking about how we're going to identify those and then collect those, this is, again, where you're working with patients to understand what's meaningful, what do we want to collect, how are we going to collect it, that's going to kind of be able to capture, again, those maybe non-traditional outcomes that we're interested in. Sorry. And then again, you got to get the word out, right? You got to make sure that you are able to kind of disseminate and get the message out on the findings that you've had, so that it can get itself, those results can get themselves back into the community and really make the change that you set out to do when you did the research. And so, while there's considerable overlap between traditional research and PCORI research, you still got to formulate a good research question. You still got to think about data integrity, like when we talked about the registry. You got to make sure that there's good analysis, and you're working within the limits of missingness of data. It's that additional focus on patient-centeredness, right, that really kind of elevates PCOR above some of these other methods of research. But it's also what makes it hard, to be perfectly honest. And again, this is from a slide from Emily Perito that I borrowed. But ultimately, when we're talking about patient-centered outcomes research, Melissa mentioned this a little bit. What we really want to do is what's called comparative effectiveness studies. And so this is where you have multiple therapies that are already out there in the community. And I think, again, our experience this morning has underscored that. And you want to understand, between those two treatments, are there differences, right? Are there ways in which we can study those different approaches to care that are going to recognize, benefit of one versus the other? And so, at the end of the day, this project impact is a step towards being able to do comparative effectiveness research within the PCORI population. And so we're excited to share the progress that we've made to date. So I'm going to turn it over to Alex, who's going to provide that update.
You guys clap for Jim. He didn't get any claps. Okay. So before I get into kind of what we've accomplished so far, I just want to say a big thank you to all of you that have participated in the modules and in our focus groups, because truly what we've accomplished is only due to your guys' participation. Thank you to the researchers and clinicians involved, because just for valuing our opinions, and thank you to the patients and families that have, taken a stand and shared their voice with the whole PFIC community. So thank you for that. And how do I click this forward? This?
No, sorry, turn it upside down so it confuse you. Yeah. Just push the forward button.
Okay, thank you. Okay, so what we've done so far, we have done the 3 modules, which were the basics of PCOR, which is what Jim just covered, and how to engage patients as partners in the research process, and how to design patient-centered outcomes research questions, which if you haven't done those 3 modules, they are still available and they're very educational. Just go to pfic.org and they're on there. And then we have also had 3 focus groups where we have collaboratively developed the Impact web app, which we'll see in a few minutes. And we've gathered patient-centered and clinical information about treatments. We co-created survey questions, and we did a lot of feedback on what the web app should look like. And we've also started early discussions of PFIC patients' research priorities, which I'll get to in a second. And we've identified ideals and barriers to research partnerships. So some of our key takeaways were the patient-reported research priorities. So this is what PFIC patients and families find really important. Understanding itch and other PFIC symptoms, comparison of procedures and outcomes by subtype, mental health and financial burdens of the disease and treatments, and incorporating patient-reported itch measures in care and trial recruitment. Our other key takeaways that were community-identified ideals and barriers to partnering in research. So the ideals would be if we had transparent communication of study information and results to participants, including research questions that are directly meaningful to patients, patients compensated for time on research team and or the input in study design. And some of the barriers that we noted were a lack of funding available for including patients on research teams, lack of researcher awareness of PCOR, and burdens of participation, including long distance travel and time commitment. And our next steps moving forward, we're gonna have 3 more modules. And as I mentioned, modules 1 to 3 are still available on the PFIC website. And we are going to be designing a PFIC research roadmap. And that's what we're gonna be focusing on for our next few focus groups. And lastly, we're gonna identify outcomes that matter most to patients for existing treatments through the Impact web app, which the beta launch is happening now, which is very exciting. So with that, I'll throw it over to Geeta and Paulo to share the web app.
Hey everybody, thanks for having me. So yeah, this is my first PFIC conference, and I gotta say it's really special to see both sides of the spectrum here, from families and clinicians, being in one room and just making things happen together. And this is what this app builds on, that same spirit. So as the name implies, we really believe that this app can make an impact on how to jumpstart some change in how research is approached. I know I was introduced as the designer, but really I'm just the co-designer because this app was truly designed by your community's voice through focus group research and then moving forward your input. So I just happened to be the one who put all the ingredients together. Functionality-wise, the app serves 2 purposes. So 1, it's a platform to provide info about PFIC treatments and patients' experiences with them. And then in return, we can learn from which treatment outcomes matter the most, so we can start to design research studies that are most relevant to those in the PFIC community. The app is designed to be simple for covering the range of ages, visually optimistic, and then most importantly, this is a dynamic work in progress, and it'll continue to evolve as we move further along. So before we dig into the app, I just want to touch a little bit on the story behind the logo. So it's inspired by that collaborative spirit between families and clinicians. And as they come together, they form the Star of Life and pursue research and discovery together. So once you get to the homepage, you'll see 3 treatment paths here anchored by a unique icon. So we have vitamins, or medications, surgical interventions, and then vitamins and nutrition. Once you click into these, you'll have a treatment path section where you'll find a list of their respective treatments. So here's vitamins and nutrition, so from MCT-based formulas all the way to vitamin K. Medications, we have them categorized as non-bile acid modulator, antipyretics, and then bile acid modulators, and then other. And then lastly, surgical intervention. And then when you click into one of these, we'll use liver transplant as an example. You'll be taken to a summary page displaying a variety of information. You'll see treatment descriptions as a clinical summary, but then also as a simplified lay summary. And if the treatment has an associated image, you'll see an illustration of that as well. And then this is the part where you get involved. So on the right-hand side, you'll find a Your Experiences Matter column with a big Share Your Experiences button. And then from here, I'll let Gita take it.
Yeah, so he's going to come back. So you have to, he deserves 2 claps, that's for sure. No, so yeah, behind the web app, there is a small survey. And this is really where the web app gets the information from, right? It's from patients for patients as an information tool. So here, when you click on the Share Your Experience, you come to, oh, perfect. You come to a welcome page, you will go through that, and then you can start your survey. There are a couple of general questions there because treatments vary for countries and so forth. And then, so when you come here, you're not only going to get a question about the treatment itself, but also how important certain effects were. So you're going to get asked, well, what were the benefits for you and how important were those benefits for you? Because we want to know these importances to then later on also establish priorities for PFIC research that is patient-informed, right? So this is basically how the survey is set up, and it should be relatively fast to answer for every treatment. So yeah, here is this like important scale that you get with every benefit or burden that you would enter. I think that's all that I have, right? Yeah.
And then after submitting your survey responses that Gita just walked through, they'll be processed and summarized by the PFIC team and then eventually added to this page. So as you scroll down, you'll see a community experiences section where benefits and burdens reflect the survey responses. Below that, you'll see impacted areas of patient life visualized as icons. So when it's on, that's what received the response, and if it's off, that doesn't apply. And when you scroll further down, you'll see a place for resources that will continue to grow, and also the opportunity to submit feedback on how we can make the app better and more catered towards you. And then we repeat the structure for the other treatment paths as well. So here, a quick look at IBAT inhibitors, and then nasogastric tube. And then you'll also notice on the actual website, the community experiences recorded number, which is currently 2 over there, is actually set to 0 just because we haven't received any survey responses just yet. So currently what's up there is what's pre-populated from focus groups. And you'll be seeing a bunch of these as well. So if treatment needs more entries, you'll see a prompt to entice you to do so. And lastly, if you're searching for a specific treatment, there's an index feature that allows you to search, filter, and sort through. And then just a reminder, this app is a dynamic work in progress, so everything you see now is just a starting point. And it'll continue to grow, and to do so, we need your participation. So we look forward to seeing the ripple effect of how this tool impacts your community. Thank you.